Hi everyone, this is Dr. Eyetemou Miguel, your pharmacist, and welcome to my channel. In this new video, we are going to talk about a very important topic. We are going to talk about male fertility issues. Mainly, what are the causes of male fertility issues? What are the things that you can do to prevent male fertility issues? First of all, let's define what we call by infertility. Infertility is the inability for a woman of reproductive age to get pregnant after regular sexual intercourse and without taking any contraceptive pills. You have to know that infertility is an issue that affects more and more people in today's society. It is estimated that 15% of couples of reproductive age are affected by infertility worldwide. That's approximately 70 million couples in the world. And in 20% of cases, both partners are to be blamed or have an issue that causes infertility. In 35% of cases, only women are to be blamed. In 30% of cases, men only are to be blamed, and in something like 15% of cases remain unexplained to date. It has been shown that sperm quality has been deteriorating over the past 40 years by 50 to 60%, and this might be one of the reasons why it is an increasing phenomenon, an increasing issue today. And it's mainly due to, as we are going to see later on the video, it's mainly due to diet, to lifestyle, and also to some environmental factors. So when it comes to sperm quality, we are talking about parameters such as sperm count, sperm concentration, sperm motility, sperm viability, and also sperm morphology. Sperm count is the number of sperm cells in your ejaculate. Sperm concentration is the concentration of cells, of sperm cells in a certain volume of ejaculate. Sperm motility and viability shows how mobile, how active, and how viable your sperm cells are. Sperm morphology is about the shape of your sperm cells. Now, in male, as the video is about male fertility issues, in male, 90% of all cases of male infertility comes from one of those three conditions: oligospermia, astenospermia, and teratospermia. Oligospermia is characterized by low sperm count. Astenospermia is when you have an absolute lack of motility, or you have a decreased motility when it comes to your sperm cells. And teratospermia is when you have not enough, or you have insufficient number of sperm cells that are of normal structure, of normal morphology or shape in your ejaculate. Now, let's see some environmental factors that might contribute to deteriorate your sperm quality. We have smoking cigarettes and cannabis. We have the use of anabolics, steroids. We have overconsumption of alcohol. We have emotional stress. We have prolonged contact with high temperatures. We have aging. We have a sedentary lifestyle, lack of physical activity. We have atmospheric pollution. We have tight clothing, so it's not always a good idea to keep wearing tight clothing on a regular basis. We have pesticides and toxins. We have lead, cadmium, cytotoxic drugs such as anti-cancer drugs or chemotherapy, and also electromagnetic radiations. Now, some elements that can cause sperm quality in your diet and mainly in your lifestyle is, for example, meal omission. So when you don't have 2 to 3 meals a day, that might contribute to lower or poorer sperm quality. And also, obesity is a condition that will increase your risk of infertility. Now, when it comes specifically to diet, we have what we call the Western diet today, which is characterized by high intake of calories, and we all know that a hypercaloric diet is pro-inflammatory, meaning that it will increase the level and the rate of inflammation in your body. The Western diet will also provide you with too much animal proteins, mainly from red meat and processed meat, saturated and trans fatty acids that are very bad for your health, as you are going to see later on in the video, and also simple carbohydrates that you will find in products such as sweets, so pastries, cookies, and so on and so forth, and also sweet drinks such as soda. And the Western diet is also very low in very healthy elements such as dietary fibers, essential fatty acids, and antioxidants. So the diet that we commonly have today in the world is the diet that does not promote male fertility, but rather does promote male infertility. So let's now talk about some foods and how they can affect or impair your sperm quality and ultimately lead you to infertility. Number one, we have trans fatty acids and saturated fatty acids. They accumulate in the testes as well as polyunsaturated fatty acid, but at the contrary, or at the opposite of polyunsaturated fatty acids, which are very healthy, very good, trans and saturated fatty acids are going to accumulate in the testes, and they are going to have a negative impact, such as lead you to poor sperm quality, lower sperm concentration, and also it will lower your levels of free and total testosterone. And we find those trans and saturated fatty acids in foods like fast food, salty and sweet snacks, and also processed and red meat. So these are definitely items that you need to lessen, that you need to decrease your intake on a regular basis. Number two, we have meat, mainly processed meat, because they are rich in saturated and trans fat, and as we have just seen, these are very bad for your sperm quality, and also they can come with some preservatives and with some hormone residues that will affect your health in a very bad and negative way. Number three, you have tobacco and alcohol. These two substances are going to impair your sperm quality, your testicular volume, and also the morphology of your sperm cells. Number four, we have caffeine. Caffeine is has not been proven to be damageable to your sperm quality. So there are not enough evidence showing that it is bad for you. But the evidence that we have about caffeine is that sweet drinks that contain caffeine might lead to damages to your sperm cells DNA. So it will be a very good idea to avoid drinking those drinks. But if you like to drink coffee, just not go beyond normal limits or beyond a recommended daily intake. Number five, you have phytoestrogens. And the main compounds that we have in this family of chemicals is isoflavones. They are estrogen-like substances, so they will have almost the same activity, the same effect as estrogen in your body, and they come with antioxidant and anti-mutagenic activities or properties. So they will fight free radicals, oxidative stress, and they will also prevent modification of your DNA. They are sometimes used in hormone replacement therapy for postmenopausal women. So far, there's not enough evidence showing that phytoestrogens are bad for your sperm quality. So if you want to take it, there is no problem. It will not impair your sperm quality. Number six, you have contaminants, such as plastic packaging, in which we find bisphenol A and phthalates. You have to use them with caution. There's not enough evidence showing that those elements can lead to male infertility. But we all know that those elements have a negative impact on reproductive health. So it would be a very good idea to use them with caution and to avoid them at maximum. And we also have in the contaminants pesticides and pollutants that you might find sometimes in your fruits and vegetables. So you have to take your fruits and vegetables from reliable sources that do not use or that use the littlest amount of these contaminants. We also have a hypercaloric diet, and we have what we call today the obesity pandemic. It is because we have a diet which is so rich in fat, which is so hypercaloric, and that will lead to intestinal dysbiosis, and ultimately it will have an impact on your sperm quality and also on the production of your sperm cells, spermatogenesis. Now, from all those things, the mechanism behind the impairment of your sperm quality, the deterioration of your sperm quality, is called oxidative stress. Oxidative stress accounts for 30 to 80% of all cases of male infertility worldwide. Oxidative stress will impair the sperm quality, motility, viability, the testicular volume, and also might lead to miscarriage and also to child development abnormalities later on. It will also impair sperm concentration. And oxidative stress comes from free radicals, because we have a balance of free radicals and antioxidants in our body. When there are too much free radicals, they go beyond the levels of antioxidants, and they cause a lot of damages to your cells, such as a sperm quality deterioration. So it is important to load yourself with antioxidants from natural sources, such as oily sea fish. Oily sea fish are going to provide you with polyunsaturated fatty acids, with fat-soluble vitamins such as vitamin A, vitamin D, vitamin E, and vitamin K. But we have to be careful, because those fish might come with mercury and neurotoxic substances. Number two, we have raw fruits and vegetables that are loaded with a lot of antioxidants, and also we will get from them fibers, minerals, and vitamins. Number three, you have nuts and seeds that will provide you with essential fatty acids, fibers, phytoesterols, polyphenols, and a lot of minerals. Number four, you have whole grain products. They will provide you with a lot of fibers and also with minerals such as zinc and magnesium. And you have to avoid or limit your intake of refined flour and go for whole grain products. Number five, we have lean dairy products, which will provide you with proteins and calcium. And you have to favor low-fat dairy products, because in it you have less amount of trans and saturated fatty acids. And number six, you have a vegetable oil such as olive oil and rapeseed oil that will provide you with vitamin E, polyphenols, alpha-linoleic acid, and also polyunsaturated fatty acids. So this is the diet. These are the foods that you need to start taking more and more in your diet for you to prevent male infertility issues. Now we end the video with antioxidants and minerals supplements that you can take apart from the diet, supplements that might help you to cope with male infertility issues. Let's start with antioxidants. Studies have proved that taking those antioxidants will improve your parameters, all those parameters that we just talked about earlier in the video. But no study has proven so far that it will increase or improve the pregnancy outcomes or the live birth rates. But it is worth taking them. Number one, you have zinc. Zinc is is even the basic element of your sperm. Prostate gland and seminal plasma have high levels of zinc because they need zinc to produce sperm and semen. So zinc is going to help your body with increasing spermatogenesis. It will improve the morphology of your sperm cells and also improve or increase sperm count. It will improve steroidogenesis, which is sometimes lacking in people suffering from oligospermia, astenosospermia, or azoospermia, conditions that might lead to male infertility. And also zinc will be good to improve sperm motility, viability, and will also prevent bacteria from damaging your sperm cells. Number 2, you have selenium, but you have to be very careful with selenium because too much selenium might be harmful for your health. Selenium is part of the glutathione peroxidase enzyme, so it will increase your enzymatic antioxidant activity, and it will help you to prevent oxidative stress from damaging the DNA in your sperm cells, and will also improve motility and viability. Number 3, we have vitamins such as vitamin C, vitamin E, and vitamin B9. Vitamin C, which is sometimes called ascorbic acid, vitamin E, tocopherol, and vitamin B9, folic acid. So they come with the antioxidant property that will decrease oxidative stress in your sperm cells. Number 4, we have coenzyme Q10, which is a very good antioxidant because it helps regenerate other antioxidants such as vitamin C and E, and will improve sperm concentration and motility. Number 5, we have L-CARNITINE, which is going to improve your sperm maturation. Number 6, you have LYCOPENE, which is a very powerful antioxidant, which also prevents prostate cancer. So very good for men to take LYCOPENE on a regular basis. And it will increase the number and the survival of sperm cells. Number 7, we have N-ACETYL-CYSTEIN, which will increase the number and the mobility of sperm cells. And we have number 8, polyunsaturated fatty acids that we can find in supplements in the form of docosahexaenoic acid and eicosapentaenoic acid. So these molecules, these substances fight inflammation, so they have anti-inflammatory properties, and in the testes and in the sperm cells, they are found in their highest concentrations. So they are found more in the testes and in the sperm than in any other tissue or cell in your body. So this shows the importance of these chemicals, the polyunsaturated fatty acids, for your sperm cells. They will increase your sperm concentration and your sperm count. They will improve your sperm morphology, and they will also get incorporated in the membrane of your sperm cells. Now, to finish the video, we have some minerals that you can take as supplements to improve your sperm quality. We have calcium, magnesium, copper, and manganese. They are going to improve your sperm motility and also to improve spermatogenesis, the production of sperm cells. Calcium is involved in acrosome reaction, which is the reaction that leads to the penetration of the spermatozoa into the egg for the fertilization of the egg. Thanks for having watched this video. Please consider liking and sharing, and also consider subscribing to my channels not to miss any upcoming video.